Hi, I'm Elena Pacheco.
And I'm Cristina Popa.
We are the 2021-22 Core Leadership Council co-chairs, and we are pleased to present to you the remarkable successes from our Eastern York, North Durham, Ontario Health Team. 2021-22 marks our second year since the Ministry of Health officially announced the establishment of Eastern York, North Durham, Ontario Health Team. And since December 2019, we've embarked on an amazing journey of delivering programs and services that have connected care to clients, families, and caregivers.
The pandemic over the past 2 years has challenged us in ways we never imagined. Through community partnership and the perseverance to improve the lives of patients in our community, we rose to the challenge and are forging the road ahead. Here is a look at what we've accomplished this year. The East York Region North Durham OHT faced COVID-19 head-on. Operating the largest mass vaccination clinic in York Region, over 56 weeks, we vaccinated over 270,000 shots, with an average of 600 shots per day, up to a max of 252 per day. Volunteers, 8 community partners, and health providers in the community came together quickly. It was an amazing show of support and collaborative efforts from our community. And as the pandemic is changing, so are our programs and service delivery models. As the medical director and lead for the Clinical Assessment Center and Mass Vaccination Clinic at Cornell Community Center, it was rewarding to see how we forge partnerships with our OHT partners, York Region Public Health, and primary care physicians with the common goal of providing an improved patient experience.
Collaboration is the key to our success at the OHT, and an important way to connect our services is through navigation and care integration. This is vital in our delivery of services and has been one of the biggest successes in improving the patient and caregiver experience. Our SCOPE program connects primary care providers to hospital-based resources and specialty services through a single point of contact, a nurse navigator based at Oak Valley Health. By referring patients to the right supports, SCOPE has developed 8 referral pathways in 4 short months and has been able to reduce visits to the emergency department and ultimately saving time and effort for primary care physicians by making the connections for them.
In our continued effort to provide support to primary care physicians and the patients we serve, Streamline Access is an essential program that provides coordinated access and navigation for physicians to 26 individualized mental health and addiction programs. Our navigator helps connect physicians, save time by searching for and connecting clients to services in the community.
JR was a referral from one of our primary care physician partners who experienced a noticeable decline in their mental health early in the pandemic. This was intensified by job loss, the declining health of one of his parents, and the end of a long-term relationship. Due to these challenges, he was in between homes. This was very discouraging for JR, causing him to be fearful and overwhelmed. As a Streamlined Access navigator, I worked with JR over multiple weeks to address the barriers he was facing. In terms of services, I was able to help connect JR by really reaching out to him, by giving him time to really share his thoughts and feelings. JR noted that he was facing some barriers because he was really struggling with identifying what he was feeling as the mental health challenges. After 3 appointments with JR, we were able to navigate and connect him to the appropriate supports and services. With our support, his outlook and mood improved and was glad to have someone to help him through this difficult time.
To meet our patients' needs within our healthcare settings and the community, a main focus for our OHT has been to deliver client-centered integrated care within an appropriate location. Our Senior Home Support Program enables us to carry out this vision.
We are very proud that the Seniors Home Support Program is the first primary care program dedicated to homebound seniors in the Markham and Stouffville region, bringing much needed care to this vulnerable population. Our program uses a single electronic medical record between Oak Valley Health and the Markham Family Health Team to support this care. We are privileged to care for frail seniors in their homes, often until end of life. Continuity and comfort of care are important to us. One of those patients was Mr. R. We are honored to have Mr. R's son and Dr. Elizabeth Mui share his story with us.
We are pleased to share the experience of Mr. Anthony Muthu Rayapu, retired principal and longtime Seniors Home Support client, who after several hospital admissions and complications from congestive heart failure, stroke, bronchiectasis, and dementia, elected to continue his medical care solely at home. We at Seniors Home Support, including our community paramedics, interdisciplinary team, and physicians, had the privilege of caring for Mr. Rayapu and his family until he passed away peacefully on May 26, 2022. We are pleased to have his family share his story today.
I really like to thank the entire team around helping us. And also I really want to thank the supporting staff like nursing department, PSW, everybody. They are very friendly with my dad. It's not only the care, it's personal and mental support throughout his last 2-year journey. I realized there are a number of different teams involved with my dad's care. To me, like it's a single team. They work together really well. So it was an extremely good program.
My grandpa's always loved being at home. Like home is where he felt the most comfortable and the most safest. So the times when he had to be hospitalized, it was really hard on our family. He was only allowed to have one visitor with him at the time, but my grandpa comes from a home where there's always 5 other individuals at home. For us, it was really comforting to have my grandpa at home with us, and it didn't feel like the process was so medicalized.
My husband, he loves his children and at the same time all grandkids. He wants to be the grandchildren and the grandkids all with him. His wish is fulfilled because of this team. And at the last breath, he was satisfied.
As you've heard throughout this video, it has been a year of many successes and milestones moments for our Ontario Health Team.
Each year, we are carving out a defined pathway to improve patient experience, improve patient outcomes, lower cost of care, and improve provider experience.
Be sure to follow along with us as we move forward on our journey through recovery to innovation.